Okay, so the CDC just a few days ago came out and tweeted that you are up to 2.5 times more likely as a child to end up with diabetes within 30 days if you get a COVID diagnosis. That is a pretty big claim, and they put up their study that they came up with this numbers for. And I just want to go through it and talk about it because, quite frankly, I have some doubts and I have some questions about this. Before we get into it, I want to be very clear. I think for other reasons that are much more scientifically valid and true, I still recommend vaccination in general. I got my own kids vaccinated. I would still make that decision today. And I don't think that we need to have this diabetes claim. I don't think it's necessary to make that a good decision. So let's talk through why I have some doubts about this. If you look at the study, I'll put the links below and I'll put up some screenshots as we talk through some of this stuff. They used two different insurance databases, IQVIA and healthverity. Frankly, I do not know where these actual systems are or what insurance companies they are associated with, but they went through and they did two different things with each of these sets. Although the claim is, hey, we looked at these two different systems, here's the information we found. The actual claim itself of the 2.5 times more likely to end up with diabetes, the implication there being that COVID caused this increase, only comes from one of the sets and is the most extreme of the numbers. So I think there's some question marks to have there. So the IQVIA set, and they used an incidence rate, or the amount of times this showed up, calculated off per 100,000 years. So they followed these kids for a period of time, X number of kids, X period of time, and they basically extrapolated from that, and they said if we were to follow kids in this age group under 18 for 100,000 years, followed 100,000 kids for 1 year, followed 200,000 kids for 6 months, 100,000 patient years, here's the incident numbers that they come up with. I'll put them up on the screen. So they said that of kids who had a COVID-19 diagnosis, the incident rate per 100,000 years was 316 for getting diabetes. And they said for people who did not have that COVID diagnosis, it was 118. That is an interesting thing. So, and that's where they kind of got that number from. That's where they got the 2.5 from. They also did a couple other things, particularly with this IQVIA group. With the IQVIA group, they went ahead and they said, okay, well, let's make sure that we're trying to rule out the notion of just other respiratory viruses causing this. So they went back in time and did the same thing using non-COVID respiratory infections and folks who did not have those non-COVID respiratory infections. And they looked at those numbers, and those were much more similar. Those numbers came out to 126 in those who had respiratory infection per 100,000 patient years, and 125 who did not. So those numbers were almost identical. It is interesting to me that when you look at it this year, that there's a larger difference between folks who have a COVID diagnosis and those who don't. That is interesting, but it doesn't always pan out, because what you don't know is that the healthverity has a completely different set of numbers, which doesn't seem to pan out. So let's go look at the healthverity numbers. Those were different. In the healthverity system, they didn't just go through and look at people who had a COVID-19 diagnosis and then everybody who didn't. That's not what they did. They did people who were sick enough to come in and get a test and had a confirmed COVID negative. So now you're talking about a different group of people. Or folks who were going to go on a traveling test, right? So you don't even know what they came in for, but folks who had a confirmed COVID negative and a COVID positive. So you're dealing with people who went in and specifically sought a test, not just the general population living at home. And since so many children are asymptomatic with COVID, that throws off the validity of the numbers because you don't really know the denominator. But we'll go ahead and look at the numbers anyway. In the healthverity numbers, the comparison between folks who had a COVID positive diagnosis, 399 per 100,000 patient years, was much closer to those who had a confirmed COVID negative, which is 304 per 100,000 patient years. But one thing I really want to point out is when you look at the two databases, and this is the trouble with introducing two data sets, is that you're not really sure that you're getting anything particularly accurate and apples to apples comparison between the two of them. Because when you look at healthverity, confirmed COVID negative incidence of diabetes by these numbers that they're putting out was 304 cases per 100,000 patient years. And if you go back to the IQVIA, confirmed COVID positive, 316 per 100,000 patient years. So those are two different sets. A confirmed COVID negative 304, confirmed COVID positive in the IQVIA 316. Now that is a much different comparison, 304 to 316 versus 118 to 316. Those are different numbers, right? So I think that the trouble we're having here is that this is an interesting call to do some study, but in terms of statistics, it's gobbledygook. And the trouble is that you can't make great assumptions and you can't make great implications and policy announcements and say, hey, this definitely causes this, because you have numbers like this. I think that there are some issues here. One, we didn't start with all kids that we knew whether they had diabetes or not and they were tested. We waited for them to show up and get in the healthcare system and find out if they had diabetes. One of the sets had folks who were all tested. They didn't control for anything beyond sex and age. They didn't control for body size. They didn't control for family history, any of that sort of stuff. They didn't control for racial history, socioeconomical issues. There was a lot of things they did not control for here. This is a study that does not necessarily, beyond a shadow of a doubt, prove the conclusion that is being pitched. I think it's a good question, and so I applaud them for coming up with a question. I think that coming out with this tweet, just announcing this, is presumptive at best, I think. So I still think it is reasonable to consider vaccination for kids. I think it reduces hospitalization. I think it, so far, who knows with Omicron, maybe something will come up different, reduces the severity of disease, and I think that is good. There are some other studies coming out that suggest that maybe it reduces the odds of the multisystem inflammatory after COVID, that condition that happens, which can be very, very scary and serious. And I'll go over that in another video. There are good questions coming out of this. I don't think we have great conclusions to come out of this. So I think the CDC maybe jumped the gun a little bit on this one. I still think vaccination works. I just don't think we need this as a sales pitch for it. So do what you want with that. Remember to always try and find sources and look through things and check the claims that people are making to you. Okay? Have a nice day.